Caitlin Carroll.
And I'm Joseph.
And we are members of the Exercise Science program at Bellarmine University.
And this lab was about the hip and thigh.
The hip is one of the most important joints in the human body, and the thigh contains some of the strongest bones and muscles for maximum support during physical activity. The hip joint has large, strong bones and tissues surrounding it, which allows for increased stability in the thigh and lower leg. The hip and thigh tend to sustain an increased amount of injuries during athletics, but both overall have less injuries than the lower leg and knee. It is important to know the different injuries that can occur in the hip and thigh in order to provide rehabilitation. This will help evaluate an individual's ability to return to play. So the purpose of this lab was to identify the bones, muscles, tendons, ligaments, and fascia of the hip joint, learn the range of motion for each, perform a Hops test to help discover different injuries to the hip and thigh, and learn several ways to prevent and rehabilitate hip and thigh injuries. So we're going to start with some strength exercises, and for these you're going to be doing 2 to 3 sets of 6 to 8 reps. So you're going to start with lunges, and you're going to do forward lunges, side lunges where the leg abducts from the body, and backwards lunges, making sure the knee does not go over the toe and running arms are being used. This exercise will strengthen the quads, hamstrings, and glutes, which will help stabilize the lower body. And next, you're going to be doing clamshells. So you're going to get on the ground, laying on your side with hips in line with the head and knees bent. Raise your upper leg and then lower it back down slowly. And to make it more difficult, you can add a resistance band. And this will help strengthen the hip and the hip abductors. So for cardiovascular, you're going to be running for 30 minutes a day at 60 to 80% of your max heart rate. And this will help maintain cardiovascular fitness, and the uneven surfaces will help strengthen the hip and the thigh. Next, for range of motion, you're going to be doing hip abduction and adduction, which is 1 set of 15 reps once a day on each leg. So you're going to lay on your side and lift your leg off the ground toward the sky, then slowly bring it back down. This will provide range of motion in the hip abductors and adductors. And next, you're going to do hip flexion and extension, and 1 set of 15 reps once a day on each leg. So standing, raise one knee upwards, then slowly bring it back down. This will help provide range of motion in the hip flexors and extensors. Next, for flexibility, you're going to do the hamstring stretch with a band, and you're going to hold this for 30 seconds on each leg twice a day. And sitting on the ground, raise one leg up and attach a resistance band on rolled up towel, using a rolled up towel or a resistance band, holding both ends of the band in each hand. Pull on the band in order to dorsiflex the foot. This will stretch the hamstring muscles and prevent them from getting too tight. Next, you have the hip flexor stretch, which you're going to hold for 30 seconds on each leg twice a day. Kneel on one leg while the other leg is bent at 90 degrees. Lean forward while maintaining the pelvis in a neutral position, allowing the hip to feel a stretch. This will stretch the hip flexors. Next, we have balance, and you're going to do single leg balance, 5 sets of 15 seconds on each leg. Stand on one foot with hands on hips, remaining upright. Bend the knee a little to challenge the muscles. To make it more difficult, close your eyes. This will help strengthen the lower leg, thigh, and hip while also practicing balance. And next, you can use a balance board, and this will be for 5 sets of 15 seconds too. And with both feet on the wobble board and a chair available for support, stand in attempts to remain still. This will help with balance throughout the leg and hip. And lastly, we have core exercises. So you're going to do forward, side, and reverse planks. 2 sets of 45 seconds for each plank. And each of these planks you need to engage your core and require strength from the hip and thigh. It's important to stabilize and engage the core and ensure a neutral spine position to get the most benefit. And the bridge with leg lift is 2 sets of 30 seconds on each leg. While doing a bridge, lift one leg off the ground. The leg lifted should be straight. The hips should not tilt to one side during this exercise. This will help strengthen hips, glutes, and hamstrings, which are essential for stabilization of the body. And hopefully with all of these exercises, you will be able to rehabilitate your hip or your thigh. Thank you.